Recording in progress.
Okay, welcome everyone to our 6th webinar in the Pathways Breast Cancer Survivorship Study series, Physical Activity and Breast Cancer, Pathways Study Results, and Clinical Recommendations. Before we begin, I just want to share a few things. First, the slides are on the website, and Janice is going to put the links to the slides in the chat. Janice Rowe from Kaiser Permanente. And there's a live transcript or captioning available if you look at the bottom of your screen on that bar. We encourage you to use the Q&A to ask questions at any time. We'll have a Q&A section at the end. We've got a lot of questions that came in ahead of time, and I expect there will be a lot of questions today. So we won't be able to get to everyone's question, but we will get to as many as we can. The chat is view only, but keep an eye out for resources there. The webinar is recorded, so the link will be emailed to everyone who registered, and it'll be posted on the Zero Breast Cancer website. The link to that is in the chat where it'll be posted to. And it's an hour-long webinar, but we may stay longer to answer more of your questions. So I'm your moderator. My name is Leanna Hartmore, and I'm Zero Breast Cancer Program and Communications Director at Collaborative for Health and the Environment. We've spent 28 years bridging communities and researchers and creating, educational resources for kids through adults to reduce the risk of breast cancer and support survivors' health and wellness. We also have a health and wellness coaching program for breast cancer survivors, which I'll tell you more about shortly. We want to thank our Pathways Survivorship Studies Community Advisory Board, which is facilitated by Zero Breast Cancer and a team at Kaiser Permanente. The Pathways study is a prospective cohort study of women diagnosed with breast cancer, and its Community Advisory Board is made up of Pathways study participants and breast cancer advocates. They give input on research priorities, community education, including giving input on the information shared today. You can learn more about the Pathways study in the link in the chat. So first off, we have Dr. Rikki Cannioto, who is an exercise scientist and cancer epidemiologist at Roswell Park Comprehensive Cancer Center in Buffalo, New York. Rikki, I'll pass it to you.
Thank you. Can you see my slides?
Yes, perfect. Thank you, Rikki.
Okay, thank you. So today I'm going to talk about physical activity and breast cancer outcomes in the Pathways study. And I have 3 main goals or takeaways for the talk today. The first is to simply develop an understanding of physical activity definitions that will help you both interpret the guidelines, the public health guidelines, and the scientific evidence that we're going to talk about today. Secondly, we're going to talk about the specific criteria, what is entailed with meeting the physical activity guidelines for Americans, and also how does this differentiate between the popular media message of getting 10,000 steps per day. And then finally, to gain an understanding of the evidence linking regular physical activity with improved breast cancer outcomes in the Pathways study. So first off, for definitions, most importantly, the term physical activity is an umbrella term that encompasses any kind of activity where your resting heart rate is increased. And physical activity is typically categorized as recreational or leisure time physical activity, which is the focus of physical activity guidelines, or occupational physical activity and or household activities, which would include things like cleaning your home or garden and yard work. Whereas exercise is a very specific term wherein the exercise that you do or the physical activity that you do is focused on improving a specific health-related fitness or sport-related fitness component. Importantly, all physical activity is not exercise, but all exercise is physical activity. Conversely, the term physical inactivity for the context today simply means that a participant is not engaging in any regular recreational or leisure time physical activity. And also, sedentary behavior is not the same thing as physical inactivity, where sedentary behavior is a specific behavior, including sitting or lying down on a couch, for example, which is relating to a very low energy expenditure. The next construct is what we call the FIT principle, and this is used to prescribe physical activity or exercise and is characterized by 4 components, including the frequency of physical activity, the intensity of physical activity, the time or the duration of each physical activity or exercise session, and of course, the type of physical activity. For example, the physical activity guidelines focus on 2 types of physical activity, including aerobic and muscle strengthening activities. So, what are the physical activity guidelines for Americans? The guidelines start out broadly by just recommending that adults should aim throughout the day to try to move more and sit less. Then the specific aerobic exercise or aerobic physical activity recommendation is to try to achieve between 150 and 300 minutes of moderate intensity physical activity each week, or 75 to 150 minutes of vigorous intensity activity each week. And importantly, these activities should be spread out throughout the week and not accomplished on one day, for example, the weekend warrior. And we'll talk about how to distinguish between moderate and vigorous intensity in upcoming slides. For muscle strengthening, the goal is to perform these types of exercises focused on your full body at least twice per week. And also for participants age 65 and above, or adults age 65 and above, balance training should also be included into muscle strengthening exercises. And the important caveat in the physical activity guidelines is that if this is overwhelming or seems to be too much, the focus should be just doing as much as you can, because any amount of activity is better than inactivity. And this little figure is just a summary of the physical activity guidelines, showing 150 minutes per week of aerobic activity and 2 days per week of muscle strengthening activity. So, how do we define physical activity from a research standpoint? In the Pathways study, we used what's called metabolic equivalent of task, and this is what we call an absolute measure of intensity, wherein metabolic equivalence less than 1.5 defines sedentary behavior. A MET between 1.5 and 3 classifies light intensity physical activity, which is not included in the physical activity guidelines for Americans. Moderate activity is a MET value between 3 and 6, and vigorous activity is 6 and above. So, how do we know what activities are a 3 or a 4 or a 6 MET? There is a publication called the Physical Activity Compendium, which classifies every activity that you could think of and provides you with a MET value. So as researchers, we use these MET values to determine whether or not participants are meeting physical activity guidelines, and we can actually classify their activity level. In practice, we use something a little bit easier called ratings of perceived exertion. And this is a relative measure. It's how you feel doing a specific exercise. And the goal for physical activity guidelines is to be somewhere between 4 and 8, which is defined as moderate activity or vigorous activity. And of course, the physical activity guidelines, I've included this purple bar to just highlight that this is the intensity level that we want to focus on for meeting the physical activity guidelines. So in the Pathways study, step one was that participants recorded their self-reported physical activity at 3 time points, at baseline, at 6-month follow-up, and at 24-month follow-up. And then we used the physical activity compendium, which I just provided a little snippet here for walking, to show you an example of where the MET value comes from. So for example, walking at a 3.0 mile pace, which is a 20-minute mile, would be the equivalent to a MET value of 3.8, which, remember from the previous slide, anything above 3 would quantify as moderate physical activity. And then I'm not going to go into too much detail here, but just to understand that we use that value of 3.8 for this particular activity to then calculate what we call MET minutes. And then we turn that into MET hours. So for example, if somebody walked 40 minutes per day, that would be 280 minutes per week. At this pace, using this MET value, we would multiply 280 minutes times 3.8, and we would obtain a MET value in terms of minutes, divide that by 60 minutes, and we get our MET hours. Now, this value, the MET hours, is what tells us whether or not a participant is meeting the physical activity guidelines. So what is the prevalence of meeting the physical activity guidelines in the Pathways study? When we have our MET value, so the MET hours that we just talked about, we then are able to classify participants into 4 activity categories. Inactive would be no physical activity during leisure time. Low activity would be less than 7.5 MET hours per week. Meeting the minimal physical activity guidelines, which is the 150 to 300 minutes per week. That equates to 7.5 to 15 point METs, and then anything above that would be high activity. And most importantly, when we talk about whether or not participants are adhering to the physical activity guidelines, these participants are those that are classified in moderate or high activity. And so we have at the 3 time points, the purple bars represent the time of enrollment, the red bars represent 6-month follow-up, and the green bars represent 24-month follow-up. And we can see that about 50% of respondents are meeting the physical activity guidelines for aerobic activity. So how do these associations relate to survival? What I've presented here is 4 curves showing how physical activity levels, described as non-adherent, which is represented by the blue line, partially adherent, which would be low physical activity, and green would be participants that are inactive. Or excuse me, green would be meeting the physical activity guidelines, red is partially adherent, and blue is non-adherent. And so what these curves show us, if you focus on the blue line for each outcome of interest, including overall survival, breast cancer specific survival, breast cancer recurrence, and then disease-free survival incorporates all 3 of these outcomes. The key takeaway that you want to notice is that this blue line is lower for all 3 curves, which indicates that meeting or exceeding the physical activity guidelines at the time of study enrollment is associated with significantly improved survival outcomes in the Pathways study. So next, we wanted to assess how the relationship between physical activity associates with these outcomes, while also considering other important factors that associate with outcomes, including age of diagnosis and breast cancer stage, grade, and tumor subtype. And we did this at 2 time points. On the left, the pink association focuses on the association of physical activity level at the time of enrollment. And what we found was that participants that fully adhered to the physical activity guidelines in comparison to inactivity was associated with a 42% reduction in all-cause mortality. Partial adherence was associated with a 30% reduction in mortality. On the right-hand side, we combined all data from 3 time points. In other words, we averaged physical activity reported at enrollment, at 6-month follow-up, and at 24-month follow-up. And we asked the same question. Does meeting the physical activity guidelines in comparison to inactivity associate with decreased mortality? And we observed that there was a 54% decrease in mortality for patients who reported adhering to the physical activity guidelines. For partial adherence, in other words, participants that were performing activity, but it was just under meeting the physical activity guidelines, there was a 37% decrease in mortality. And these analyses were adjusted for age of diagnosis, menopause status, stage, marital status, comorbidities, and breast cancer subtype. The next outcome that we looked at was breast cancer specific mortality. And again, on the left-hand side in the yellow, these associations focus on activity reported at the time of study enrollment. So we can see that full adherence to the physical activity guidelines versus inactivity was associated with a 35% reduction in breast cancer specific mortality. But there was no significant association when looking at partial adherence versus inactivity. When we looked at the average physical activity level reported across the 3 time points, we saw similar associations, but stronger, where full adherence to the physical activity guidelines was associated with a 46% reduction in breast cancer specific mortality. And again, no significant association was observed for partial adherence. And lastly, we looked at progression. And in today's talk, progression represents a combination of all of the outcomes represented in the survival curves, including disease recurrence or death from any cause. And when we look at associations at the time of enrollment, we observed that full adherence to the physical activity guidelines was associated with a 31% reduction in progression, and partial adherence was associated with a 26% reduction in progression. When we combined the data, we saw similar but stronger associations where full adherence to the physical activity guidelines over all 3 time points was associated with a 41% reduction in breast cancer progression, and partial adherence was associated with a 28% reduction. So how does the physical activity guidelines associate with what we hear about daily steps? There's actually no public health guidance regarding steps per day. But when we think about steps, we want to think about purposeful versus incidental steps. Purposeful being the steps that you take when you're actually participating in physical activity in your leisure time versus steps of daily living. And data combined from several recent studies called meta-analyses suggest that more total steps are better, but that benefits start to level off at 10,000 steps for all-cause mortality and 12,000 steps for cancer-specific mortality. However, this leveling off is lower for women and older adults, suggesting that approximately 8,000 steps per day would provide optimal benefits in terms of reduction in either all-cause mortality or cancer-related mortality. But more evidence is needed before this is translated to a public health guideline. So in summary, what we learned today is we learned that the physical activity guidelines recommend 150 to 300 minutes of moderate intensity physical activity or 75 to 150 vigorous minutes. So an example of a moderate activity would be walking at a moderate pace. Vigorous would be jogging a 10-minute mile, for example. For age 65 and above, you want to incorporate balance training and, of course, strength training twice per week. In the Pathways study, about half of the participants, give or take, report meeting the aerobic physical activity guidelines, which is associated with up to a 54% decrease in overall mortality, a 46% decrease in breast cancer specific mortality, and a 41% decrease in progression. In the Pathways study, lower levels of physical activity also associate with benefits, but the benefits are smaller for overall mortality and breast cancer progression. And this is just a refresher of the summary of the physical activity guidelines. So the takeaway messages from both what we know about public health messaging and the scientific evidence is that if you can't meet the physical activity guidelines, any amount of activity is better than inactivity. There are currently no public health guidelines for steps per day, but aiming for approximately 7,000 to 8,000 total steps per day will provide health benefits and decrease risks of mortality. And to give you an example of how meeting the physical activity guidelines would translate to steps, using the example of walking 3 miles an hour, which is about an average pace for walking, it's a 20-minute mile, for 22 to 44 minutes per day would be sufficient for meeting the physical activity guidelines. However, that's only 2,200 to 4,400 steps. So the move more, sit less recommendation aims to increase incidental steps throughout the day beyond what is needed to meet the physical activity guidelines. And that concludes my talk for today. I want to acknowledge everybody that made all of those data possible and invited me to share the data today. And I can take questions now, or do we wait for questions?
We're going to do questions all together at the end. Thank you so much,
Okay.
Rikki. That was very informative. So we're going to
Okay,
pass
thank
it to
you.
Holly Rodriguez, who has been practicing physical therapy for 21 years and works at a clinic in the clinic at Kaiser Permanente Vacaville. Thank you, Holly.
Thank you for having me. Just one quick sec. All right, so today I'm going to be talking about exercise after breast
Holly,
cancer.
your slides were perfect when you first did it, but now we can see the back end of your slide, so I don't know if you
Okay.
changed something.
Um,
There you go. Now we can see them perfectly.
okay. I can't see my presenter notes, so.
Okay. If you share the other way, we'll all see your presenter notes. So I don't know which trade-off you want to do.
Okay. Thank you. Thank you for having me here. So today I'm going to be talking about exercise after breast cancer and survivorship. So it'll be after surgery and treatment. So my outline for today, I will be talking about current research, considerations in starting an exercise program, where to start, strength after breast cancer, a progression of an exercise program, and then I'll conclude with additional tips and my take-home message. And so the current research, when we look at Schmidt et al., exercise is medicine. It's found to increase aerobic capacity, improve muscle strength, balance quality of life, and lessen depression. Neiman found that there's a strong link between exercise and the immune system. Ficara et al. Found that exercise interventions are a valuable strategy to avoid the decline of cardiorespiratory fitness, strength, fatigue, and improved quality of life. And Michio et al. Found that exercise reduces breast cancer risk and recurrence and enhances survival. So all the research is pointing to that exercise is good, right? We know that. And so considerations when starting an exercise program. First, you want to make sure that you're cleared by your doctor to start exercising after your surgery and or treatment. If you exercise before your surgery and or treatment, do not resume where you left off prior. Your system may not be ready to be at that higher level where you may have left off. And so it's always good to start slow and progress gradually, and then stop if you have any pain. And it often takes longer to get back to your previous program than you'd expect. So don't be alarmed if that is happening. And it's okay to modify your exercise and to ask for help. If you're not sure where to start, you can always ask your doctor to be referred to a PT that specializes in oncology rehab or someone with those similar qualifications. And so some special considerations with having breast cancer as we're getting back to exercise. So we have lymphedema or risk thereof. And so lymphedema is just abnormal swelling that happens in the body when the lymphatic system can't keep up with the demand of the fluid. And for breast cancer, that would be within that upper quadrant on the same side as you've had breast cancer. And so really what you're wanting to be watching for are what we call HAFNIS. So that is an acronym that stands for heaviness, aching, fatigue, numbness, tingling, and swelling. So that would be within that upper quadrants, that'd be the chest and the arm. And so if you have any one or more of those symptoms, then you'd want to back off, take a rest, and then you can go back to the activity once those symptoms have subsided. And avoiding extreme temperatures with exercise, too hot or too cold could make your lymphatic system work harder. So just keep that in mind as you're exercising at those temperatures. Also caution with high altitude. With that higher altitude, there's less atmospheric air pressing on us, and so sometimes people swell more at those higher altitudes. And if you have compression, it's important to wear your compression garments, especially with exercising. It just helps with that venous and lymphatic return. Neuropathy is also common, especially with having chemotherapy. And so that could be with any of the platins or the Taxols. And so you just want to take precaution with balance, make sure you're wearing supportive shoes, watching tripping hazards. And then sometimes you may need to, if you have some neuropathy in your hands, then you may need to use something with a little bit wider grip. Sometimes that's more comfortable than something with a tighter grip. And then sometimes people can get neuropathy from just a nerve that is pinched, and that would be more on one side versus traditional neuropathy with chemotherapy. So just keep that in mind as you're starting to exercise. And then osteoporosis can also be a side effect of some different cancer treatments. And so it would be important to do weight-bearing activities, strengthening and balance activities can be helpful, and trying to reduce falls and improve bone health. And you really want to try to avoid twisting and bending the spine, especially with lifting, like with a weight. Some additional considerations when we're thinking about exercise is cardiotoxicity. There's some chemotherapies like Herceptin and Adriamycin that could, cause some additional issues with the heart. And so we just have to keep that in mind as we're getting back to exercise. So we want to start low and slow. I call it doing the talk test, or you may have heard that. So you want to be able to talk while you're exercising initially, just to have a good place to start that's safe. Follow phases of treatment with rate of perceived exertion scale, which Rikki showed earlier. I'll show in just a moment too, as a reminder. And we can also use a targeted heart rate formula to exercise within safe zones. Radiation is another consideration. Radiation fibrosis is common. It's just a type of scar tissue that can form in the area that's been radiated, and so that tissue isn't as elastic, and so it's important to make sure that you're doing gentle stretching, and even up to a couple years after radiation. Sometimes people aren't stiff, but you can always check in with yourself, and if you're feeling stiff, then you can make sure that you're doing your stretches to make sure you're not continuing to stiffen up. And then adjuvant hormone treatment. So these are the tamoxifen or aromatase inhibitors. And so that would be with the estrogen receptor positive targeted type treatment, usually in a pill form given after. So it's just important to be working on pacing and watching overheating and protecting your joints. And so when we think about exercising, especially if you haven't been exercising or if you've had chemotherapy that could affect the heart, this has been a safe place to start. And I do this with all my patients who've been on chemotherapy or if they're starting an exercise program too. And so we want to find the resting heart rate. And so that would be ideally taking lying down or sitting very still, kind of that first thing in the morning, finding that resting heart rate. And we can use the Tanaka formula for the heart rate max. It's been found to be a better predictor rather than doing 220 minus the age. So heart rate max is 208 minus 0.7 times age. And then we use the Carbonin formula. So it's, you can see it here, the heart rate formula is heart rate max minus the heart rate rest. And then you can multiply that by the percent intensity that you're wanting to exercise in. So you could, times it by 30 and then times it by 40, and it'll give you a range. And then you're adding that heart rate rest at the end. And so this is where we can look at that rate of perceived exertion again. So, Rikki covered that nicely with looking at, 1 being very light activity and then 10 being that max effort activity. And so here we can actually look at phases of treatment and then using that scale as a relative measure. So we have phase 1, so that would be during chemotherapy. I know I'm talking more a bit about exercise after treatment, but I do think it's important if you've had chemotherapy or when you're first starting an exercise program, this is a nice place to start, especially with one of those chemotherapies that could affect the heart. So I would have someone start at a RPE scale, so that rate of perceived exertion between the 1 to 3. So that would be pretty easy activity. And then I would do that calculation with between 30 and 45%. And then I would have them watch their heart rate and have it stay within that activity. The 1 is just a rep max. And so sometimes you might see that in the literature. Phase 2 would be the next phase. So like after 3 months, is after someone's finished their chemotherapy, then you look at trying to proceed into a phase 2. And that would be increasing that RPE to that light to moderate, so the 3 to 6, and then calculating to about 40 to 60% with the heart rate. And then phase 3 would be the next 3 months after, so increasing that rate of perceived exertion, and then also increasing the heart rate too with a 60 to 85%. That is person specific, and so you'd always want to talk with your doctor or your healthcare professional to make sure that that is right specifically for you. And so where to start? And so many studies have shown that walking is a great place to start. It just can help increase cardio pulmonary function. It can improve quality of life. Water has also been found to be a great place to exercise. It protects your joints. With lymphedema, it gives some hydrostatic compression, and so it's giving you that compression as if you were like wearing compression garments in the water. Classes tend to be fun too, and it's just easier just to move, and it's been found to improve range of motion, cardiopulmonary endurance as well, and quality of life. Biking can also be a great place to start. I would recommend doing a recumbent or a stationary bike, and so it just reduces any fall risks and any traffic and things going on around you, and so you can go at your own pace. Also very helpful with cardiopulmonary endurance as well, that aerobic activity. Yoga and stretching can also be helpful. Again, just kind of working on that breath work. It can help with anxiety, quality of life as well, improving muscle length I would just be careful with doing positions where you're weight bearing through your arms. You want to work up to that. Sometimes that can be a little bit too much as you're starting. And then Tai Chi and Qigong have also been found to be helpful in improving quality of life, mobility, reducing risk of falls, and just overall quality of life as well. So these tend to be really nice places to start. There's also been some great research coming out with working on HIIT principles, so doing high intensity interval training and starting, even just a little bit at a time and then working up with the time of exercise. And so the American College of Sports Medicine Task Force that was led by Catherine Schmidt, it's called Moving Through Cancer. And so Rikki already pointed out these as well, but doing aerobic exercise, building up to 150 to 300 minutes of moderate aerobic activity per week, or doing the 75 to 150 minutes of vigorous intensity. Doing resistance exercises 2 to 3 days per week. I would not do them back-to-back days. I have my patients do a day off in between just to allow their system to recover. Stretching exercises, I would have my patients do them at least 2 to 3 times per week. I would recommend that as well, just to maintain flexibility. And then balance exercises 2 to 3 days per week. And as Rikki mentioned too, adding that into resistance exercises if over 65. But if you've been through chemotherapy and you're having challenges with your balance, and you're not 65, you're younger, from your chemo, and I would include those at any time, really. I think that they're just great, and we start to lose that as we get older too. And so general recommendation, exercise several times a week for at least 10 minutes at a time, and you can work up to that as needed. I've been telling my patients just to, even just a couple minutes here or there, just doing a little, dancing while they're, for a couple minutes at a time, or even just doing a little pedaler on their bike during a commercial break, things like that, and calling them exercise snacks. And so they can work on that throughout the day. There's been some amazing research with strength after breast cancer with Catherine Schmidt too. So this was based on a large clinical trial conducted at the University of Pennsylvania called the PAL trial. And so they looked at 154 survivors without lymphedema and 141 survivors with lymphedema. And they looked at the safety of twice weekly progressive strengthening in breast cancer survivors. So they looked at between 1 and 15 years post-diagnosis of breast cancer were assessed. And the study showed that women who participate had the benefits of, so they had the risk of worsening lymphedema, it decreased by 50%. The risk of developing lymphedema also decreased by 70%. It increased strength and energy, improved body image, decreased body fat, and increased overall physical function.
Thank you so much, Holly. If you want to just finish up a couple sentences, I'm happy to give you a tiny bit more time, but we're about
Sure, yeah. So the strength after breast cancer just included these specific things, and you can always check with your local areas to see if they may offer this program or work with your physical therapist. Quickly progression of exercise, go low and slow, no pain, little body resistance at a time, adding that. So doing like a wall versus countertop or chair, then floor for planking. You never want to increase time or resistance or tension or incline at the same time. It would be one or the other. And then again, watching for those half knits for any stress on the lymphatic system and keeping good posture. And so lastly, exercise is important in reducing the risk of recurrence and shown to improve endurance, strength, decrease depression, and improve quality of life. Find the type of exercise you enjoy. Don't be afraid to try new types of activity. Exercise with a friend, seek modifications when needed. Create an activity log to help track what you're doing. And it may take longer than you expect to get back to where you were before exercise with your exercise routine prior to breast cancer treatment. And not sure to start, then reach out so you can talk to someone who is trained in that, and a little activity can go a long way.
Thank you so much, Holly.
Thank you.
Thank you very much. Okay, we'll have you join back in a little bit. I'm going to give a presentation on health and wellness coaching, which is a way to implement a lot of these important things that you learned today. So health and wellness coaching is an evidence-based approach to increasing different healthy activities, but including making physical activity sustainable. And it's a powerful tool to help people not just start, but truly sustain a more active lifestyle. Most people are aware of at least some benefits of physical activity, like more energy, better sleep, and improved mental health, but knowing isn't always doing. Transitioning from knowing the benefits to consistently applying that knowledge can be a significant challenge. Individuals often face internal and external barriers, such as sustained lack of motivation, difficulty having consistent habits, navigating inevitable disruptions, and these challenges highlight a gap between intention and action, which traditional models of care don't always approach or resolve. So the coach approach is really relevant for providing a collaborative process. A health coach does not direct exercises like a trainer or prescribe exercises like a physical therapist. But these recommendations are crucial guidance for what a coach focuses on. So coaches establish a collaborative partnership with clients, and it's fundamentally client-centered, meaning the client is the expert in their own life. And through thought-provoking questions and a guided discussion, the coach's role is to facilitate self-discovery and internal motivation, drawing on an individual's strengths and values to align their actions with their goals. The National Board for Health and Wellness Coaching Certification signifies a rigorous standard of training and ensures that coaches are equipped with a high level of competency and ethical practice. And I'm a board-certified health and wellness coach. So in the context of physical activity, a health coach helps in several ways. First, we assist with goal clarification, where we move beyond generic objectives like be more active to help clients look at what's meaningful and achievable as a goal for them personally. Second, we work together on barrier identification by proactively exploring potential obstacles such as time constraints or competing priorities, and develop realistic, flexible strategies to navigate them. Third, we facilitate strategy development, which involves helping the client generate and select evidence-based strategies that are most likely to lead to long-term success. And fourth, we provide sustained accountability through regular check-ins and non-judgmental support, helping clients maintain momentum and reinforce new behaviors, which can turn short-term efforts into lasting habits. So the goal of a health and wellness coach is to foster self-advocacy, which is a belief in one's capacity to execute behaviors necessary for desired outcome. Zero Breast Cancer at Shea offers free health and wellness coaching to breast cancer survivors after active treatment in Northern California. And coaches are certified by a National Board of Health and Wellness Coaches approved training program. Sessions are 30 minutes long over 12 weeks on Zoom, and the 12-week program duration helps clients develop sustainable habits. Focus areas include physical activity, but also eating, sleep, stress management, and limiting exposure to toxic chemicals. So if you're interested, there is a link to more information and the application in the chat. And we're also sharing resources for Kaiser Permanente members. There is free wellness coaching over the phone and free app coaching through Headspace. The links are for Northern California, but they are available in other regions and other states as well through Kaiser if you have that health plan. So now we're going to move into questions. And first, I want to thank our speakers and also introduce Lawrence Kushi. Larry is Director of Scientific Policy at the Kaiser Permanente Northern California Division of Research and leads the Pathways study. So please put your questions in the chat. We have more than we'll be able to address today, but look forward to getting to as many as possible. So if the speakers want to turn on their video as well, we can get going. All right, thank you, everybody. So I want to start off with a question for Rikki and Larry that we got over email ahead of time. So this person said, my layperson's understanding of chemotherapy is it works best when it stays in your system for as long as possible and kills the cells it's trying to attack. exercise tends to increase metabolism. So is it detrimental to exercise after chemotherapy treatment with a possibility of metabolizing the chemo out of your system more quickly than it should be? I'll let you go first, Rikki.
Yeah, that's a really great question. And to my knowledge, there isn't a specific study that addresses that specific question. However, there is mounting evidence that exercise during treatment, meaning during the phase of the treatment area, not actually exercising while you're getting your chemotherapy infusion, is associated with improved patient-reported outcomes. So factors like decreased side effects from treatment, decreased cancer-related fatigue. There's some evidence suggesting that physical activity improves chemotherapy-induced neuropathy, decreased anxiety, decreased depression. There is also a recommendation from ASCO, which encourages patients undergoing active treatment to try to achieve the physical activity guidelines. So there's more, and that is a relatively new recommendation from 2022.
Thank you. I don't know if you have anything to add, Larry.
No, not really. I think that the studies generally, as Rikki, reviewed, do indicate that physical activity results in better longer-term outcomes. And so even if, there's a possible impact on chemotherapy effectiveness sort of during that time period, it seems like physical activity, regardless of whether it's during the active treatment period or subsequently, is generally beneficial. So I wouldn't necessarily worry about the effectiveness of the chemotherapy per se, if you're being active during that time period.
Thanks, Larry. Okay, Holly, I have somebody asking, after single mastectomy, how can I keep muscles on the side of my chest and under my arm from getting soft and flabby on that side?
Excuse me. So I mean, I would work with a physical therapist or someone who's trying to know what else you've been through. And then I would specifically like muscle test and see where you were at. And then I would give exercises based on that. It just depends. I usually don't start with weight, but then I will start increasing it as patients are able to get through their full range of motion. It is a little bit person specific, but it's hard to do some of those pec exercises that maybe had been easier to do prior to surgery. Usually we'll start more with doing more biceps or triceps and just getting in some postural exercises just to make sure that there's a really good foundation before I start adding some exercises where the arms start to go away from the body.
Great, thank you. So somebody's wondering what you think about HIIT methods.
Yeah, there's been some
Intensity
research coming out and showing that it can be effective in even just reducing the risk of recurrence in breast cancer. So there's been a couple studies within the last couple of years that are recommending that. The amount of participants in the study were a little low. I think there was only about 30 or so in some of those. And so it'd be really interesting to see where the research goes. But as Rikki was presenting, any activity is going to be great, and it was shown in your pathways study to reduce the risk. So I think it could be a great place to exercise with it potentially.
Yeah, and I'll just add that there, as Holly mentioned, there are a few studies more recently in people with cancer, including during cancer, chemotherapy or whatever. But but I wouldn't say that the evidence yet is definitive. The most recent guidelines from like the American College of Sports Medicine and North American Cancer Society, indicate that the the HIT methods, high intensity interval training type methods, that the evidence is still out, specifically about that, but in general, because it is aging activity, could be helpful. So.
Thank you. Okay, Holly, what ideas do you have for exercise snacks? So a few minutes at a time.
Yeah, so I think if you like to do a certain activity, like I like to dance, and so I'm always just kind of dancing or doing just some movement while there's a commercial going on or while I'm waiting for my food to be ready in the microwave. So just finding something that you enjoy doing. I mentioned doing like a little like cycle, like a leg pedaler, or even just doing just some very, very lightweight uh, strengthening exercises. I'll do stand at the counter and do just some marching, going up and down on my heels and toes, bringing my leg out to the side, just trying to get some major muscle groups as I'm, waiting for like my food to be ready, or as I'm just washing my hands, I'll even just do a couple squats, mini squats, and just hold for a few seconds and come up. I can hold them longer. So those tend to be pretty easy for people to incorporate throughout their day.
Great, thank you. So Rikki, why doesn't light intensity activity or household and occupational activities count toward meeting the physical activity guidelines?
So right now, the scientific evidence isn't well established linking light intensity physical activities with cancer outcomes. However, there are, I believe, in the next physical activity guidelines that is published in upcoming years, I think that they're going to speak to that. For household and occupational activity, there's actually a paradox in the literature. So right now, there's no convincing evidence to suggest that occupational activity is associated with improved health. And in fact, there's a paradox in the literature that suggests that higher amounts of occupational therapy in some studies, not all, have been shown to be associated with worse health outcomes. And this might be associated with other factors that are related to certain jobs that are characterized by a lot of physical activity. For example, perhaps people who are more active in their job, for example, construction, they may have a lifestyle that's more strongly associated with cancer, like increased smoking. So we don't really understand why the paradox exists, but we know that the evidence for moderate to vigorous physical activity intensity in your leisure time is well established. So that's why the recommendation is focused on those activities.
Thanks. Holly, once lymphedema is well established, is physical activity of all kinds, like cardio, weights, and yoga, beneficial as long as good lymphedema management for fibrosis, lymph drainage, etc., is maintained?
Yes. Yeah. I would just make sure that you're wearing your compression and then watch for those half knits, right? Heavy, achy fatigue, numbness, tingling, swelling. If you're starting to overload your lymphatic system with the activity and it can't keep up, you're going to feel one or more of those symptoms. And so I would just take a rest and modify, and then you can go back to the activity. But yes, there's been a lot of research showing that you can safely do some strengthening and all those type of activities without flaring your lymphedema, as long as you're kind of following those principles.
Great, thank you. So somebody asked, if I have 20 minutes, what types of physical activities give you the most bang for your buck? Whichever of you wants to answer that.
I can try to address that question. That's a good question. If you have 20 minutes per day, there isn't one best exercise to do, in the sense that it's most important to pick something that you'll be consistent with. So if that's walking and you love walking, then pick walking. If it's biking and you know that you'll look forward to doing biking every day, then you can pick biking. But overall, it's also important to work in the muscle strengthening exercises as well. And then the only other point to consider when selecting an exercise, assuming that there are no contraindications, so assuming that it's safe for you to do so, picking an exercise that's weight bearing. In other words, you're moving your body through space versus, so for example, when you're walking on a sidewalk or you're walking on a bike path, you're actually moving your body through space, and there is benefits in terms of bone health and bone strength and muscular strength to do that type of exercise versus a recumbent bike. It's not necessarily weight bearing, although you can increase the resistance.
Yeah, I think I generally agree with what Rikki said. If you have 20 minutes, something that you want to do is better than trying to do something that you're not like looking forward to doing. So,
Right.
All right, thank you. So somebody's wondering if there's different studies showing the effectiveness of exercise on different breast cancer subtypes, or if you've looked into breast cancer subtypes at all.
I can address that question.
Mm-hmm.
So when you want to look at breast cancer subtype, it's better to be able to combine data from multiple studies because it gives you greater numbers to be able to assess the association. So one of the things that I'm working on right now, we haven't published on this yet, but we've looked at data from the Pathways study, so the data that I presented today. And then we've also looked at similar data from 2 additional breast cancer studies. And we combined all that data and we assessed the association by breast cancer subtype. And we saw essentially the same relationships that I reported today, or very similar relationships that I reported today, for mortality in all subtypes. So it seems to be consistent. However, you do need very large numbers to be able to look at those associations. So seeing it in one study is not necessarily, so sometimes single studies will not be able to report that finding because there aren't enough, for example, triple negative breast cancer patients to be able to assess that association.
Mm-hmm. Thank you. So somebody wrote they would love to hear about the impact of yoga versus traditional strength training and aiding in bone health for postmenopausal women and/or women taking estrogen blockers. Do you have any thoughts on that, Holly?
There's not a lot of research out there with yoga. I mean, there's been some that'll say that's good, and that's it tends to be an easy place for people to start, especially with the flow and more of the stretching, and just getting some posture awareness, helping with balance, things like that. I haven't seen any specific research with that.
Yeah.
Yeah.
Thank you. We're gonna continue for just a couple minutes longer, but I do want to thank everybody for attending if they have to hop off at the hour. There's a survey that'll come up and we really appreciate you filling it out. There's also going to be a follow-up email with the link to the recording. And our next webinar will be in spring 2026. So thank you, everybody. I have a question on how to avoid lymphedema as you start weight-bearing exercises to reduce the chance of osteoporosis.
Yeah. So with the Strength After Breast Cancer, they that program, they had patients start, and I know I say low and slow a lot, but I think it is important just to allow the lymphatic system to be able to keep up. And so what they did is they started with the lowest weight possible. And so you would do like a 1 pound weight and do 10 reps and do that 2 to 3 times a week with a rest day off in between. And then if there were no symptoms, then the next week you can go to 2 sets of 10 with that same 1 pound. And then if no symptoms, then the third week, then 3 sets of 10 with the 1 pound. And if no symptoms, then the next week you can increase the weight to 2 pounds or the next available, and then do 2 sets of 10 that week. And then kind of increasing it that way. So you're always going up to 3 sets of 10. And then if there's no symptoms, then you can drop it back to 2 sets of 10 and then increase the weight to the next available. So it's just, again, this low and slow, but allowing your lymphatic system in your body to be able to keep up with the demand of what you're asking it to do. And so if you did have any symptoms, let's say, you got to 4 pounds and you're doing 2 sets of 10, you're like, oh, I'm starting to feel any more of those half knits, heavy, achy fatigue, numbness, tingling, swelling, then I would back it off a week. And so you can go back to the 3 pounds and doing the 3 sets of 10, and then you can try it the next week. And so, and if you took a week off with a vacation or you weren't feeling good, then you would go back a week in that sequencing. And then if you took a month or more off, then you would start all the way back at the beginning. And so that tended to be a good way to increase strength with having breast cancer. Before, when I first started, many surgeons were saying you can never lift more than like 5 or 10 pounds forever. And, and so it's so great with the research coming out with these good numbers of participants showing that you can do it safely. And if you are having those symptoms, to get treatment right away for lymphedema. Don't let it linger and wait, because then it can become harder to treat over time.
Great, thank you. Someone's wondering with walking, if they wear a weighted vest, does that give the weight strength training you need? What do you think, Holly?
I do any of my other colleagues on here have a good answer for that?
Yeah, I can't say that I know specifically as far
Yeah.
as that goes. It's probably not a bad idea. It's something that you can do and you would like to incorporate, but I don't know specifically about sort of meeting weight training. I don't know if Rikki has anything to add.
Sure. So weighted vests are great, and you want to, so there was some recent research that was published to suggest that if you select a vest that is 15% of your body weight, that is optimal for benefits. However, it doesn't replace strength training, because recall that the physical activity recommendation suggests that you perform weight training exercises for each major body part. So that means your bicep, your quadricep, your hamstring, your chest muscles, your back muscles. Although the vest is great and will provide increased energy expenditure, it's not going to do anything for strengthening your individual muscles, like your bicep or your tricep, your arm muscles, for example. So you still want to be able to incorporate a full body workout in terms of muscle strengthening.
Great.
Yeah.
All right. Did you have something to add, Larry?
No, just a couple of logistic things which maybe you can address as you close out. One is, are slides going to be available? I noticed someone was asking, but you said
Yes.
noted
Slides
that.
are already available on our
Okay.
website, and that
Okay.
link was provided in the chat. I can put it in
Okay,
again.
great.
And the recording will be at the same link. And you
Okay,
can
yeah.
see the recordings from our past webinars and the slides from past webinars at that same link too.
Okay, yeah, that's what I thought. I wanted to make certain that you did say that. And then the other is questions that were not answered in the Q&A.
Yeah, if you want to email us, some of the questions that we couldn't address everything. There's a lot of questions, so I apologize if we didn't get to yours. If there's something that you really need answered, you can email us. I'll put my email in the chat. And yeah, it was great. Thank you so much, everybody, for coming. Thank you to the speakers, and have a nice rest of your day.
Thanks.